The CECC on Thursday announced 23,822 local COVID infections and 62 COVID-related deaths. It also reported that a suspected cluster infection at a shipyard in Southern Taiwan was in fact two separate clusters.
One was caused by the BA.2 strain, which is dominant in Taiwan. The other, involving a shipyard employee and his two children, was caused by the BA.5, signaling that the subvariant could already be spreading in the community. The CECC says it is not considering tightening COVID measures.
Concerns that a cluster infection at a shipbuilding factory in Kaohsiung was caused by the BA.5 subvariant have been dispelled after genetic sequencing showed that 4 of the workers were infected with the BA.2 subvariant.
船厂的员工
The factory cluster infection and the family cluster involving BA.5, in fact, are two separate events.
In a cluster infection at a shipbuilding factory, 10 contacts tested positive in a first round of testing. Samples from 7 of those 10 were sent for genetic sequencing, and 4 came back as BA.2, the most common subvariant in Taiwan. The CT values of the other 3 were too low for testing. Only the initial case from the factory and his 2 children were found to be infected with BA.5. With the source of the initial case's infection unknown, the CECC said there is likely already community transmission of BA.5. It advised the public to exercise caution, but said there are currently no plans to implement stricter public health measures.
目前来讲，我们还是
What we are concerned about now is the possibility that BA.5 has already spread in the community. This newest subvariant will likely continue to spread throughout the community in some way and eventually replace BA.2 as the dominant strain.
The CECC says that mid-August will probably see another wave of infections as BA.5 becomes the dominant strain in Taiwan. Next-generation boosters targeting new variants will only become available in the fall, months after the BA.5 wave. The CECC says that despite that, there are no plans to open up eligibility for 4th shots to the general population.
如果比较年轻的族群
Comparatively speaking, if we give 4th shots to young people, it will increase antibodies to levels just slightly higher than those following the 3rd shots. However, in terms of slowing infection or preventing severe symptoms, there's no real noticeable effect. So we don't have any plans for widespread vaccination with 4 shots.
Around the world, Israel, France, the US, Thailand, Japan, and South Korea have rolled out 4th shots, but in all cases, availability has been restricted to certain demographics. The CECC says that for now it will continue to focus on high-risk groups for additional booster shots, saying the benefit of more boosters for youth is negligible.